Well, millions of people are living with type 2 diabetes, and if you have this medical condition, it can be very frustrating. Well, there's a new initiative out there called Type to Talk. It's going to help you deal with this challenge. Joining us this morning to talk about Type to Talk is Dr. Robert Zimmerman, long title, Director of Diabetes Center at the Department of Endocrinology, Diabetes and Metabolism at the Cleveland Clinic. You must have a very large name tag. Thank you so much for joining us this morning, Doctor. Tell us about this Type to Talk initiative.
Well, basically, this is a thing that has been put together by the American Association of Clinical Endocrinology in association with Bristol-Myers Squibb and AstraZeneca to help patients interact well with their physicians when they see their endocrinologist or their physician about type 2 diabetes. So sometimes patients will come to see their doctor and will forget what sorts of questions or problems that they're having. They'll forget what their medications are, or they won't have the doses of the medications that they have. And so they're not prepared for their visit with their physician. And what this website, type2talk.com, gives them is the tools that they need in order to better fulfill this interaction that they're having in the short visit they have with their physician and really address the issues that they have.
In that short visit, and you said a lot of people forget, but there's also people who are afraid to talk to their doctors. Why do you think that is? I mean, this is their health they're talking about.
Well, there's some of the things, the complications of diabetes are sometimes a little bit difficult to discuss. And so, again, if you write down some of the issues that you're having that you might feel that you're afraid to talk about, but if you have it on a piece of paper and you can say, I want to talk about this issue with my doctor, you'll at least bring it up and we'll be able to have that problem addressed.
Are the doctors going through a specific training for this Type to Talk with their patients?
The doctors, I think, can utilize some of the forms that are offered on this site to help the patients with their interactions with the doctors. There are forms on this site that you can download where you put down the list of your medications. There are forms that you download that have discussions about issues that you want to talk about, referrals that you might need, questions that you have about what you don't understand. There's all kinds of different tools that are available on this site to make it so that both the physician and their patient will have a much more fruitful interaction when they see each other.
Basically, it's holding the patient's hands so they know exactly what specific questions to ask and the tests and everything else. So what is the A1C test, and how does that help a person with diabetes?
The A1C test is a test that we can look at to assess the average blood sugar control that a patient has. The American Association of Clinical Endocrinology recommends that patients who have diabetes try to achieve a hemoglobin A1C of approximately 6.5%. This is, when one looks at your blood sugar, it can change because of what you ate yesterday or today or right away, whereas to really see how a patient is doing, you need to have sort of a way of looking at an average blood sugar reading, and the A1C gives you a 3-month average reading of what your blood sugar is.
Doctor, how many people in this country actually are diagnosed with type 2 diabetes?
Approximately 23 million people have diabetes in this country, and actually in Ohio it's 850,000 people have diabetes, and that's about 8% of the population of Ohio have diabetes.
What can happen if people don't seek treatment?
If you have diabetes and you're not adequately controlled over a long period of time, you're at higher risk for developing complications of diabetes. The complications of diabetes, long-term complications, are problems that you can develop with your eyes, with your kidneys, with your nerves, and then some of the large vessel diseases that are complications of diabetes include heart attacks, strokes, and peripheral vascular disease.
And lastly, what is the website once again, because there's a lot of information on that website?
It's www.type2talk.com.
All right, Dr. Zimmerman, thank you so much for coming on the show. I greatly appreciate that information. Take advantage of that website. All right, we'll come back on Good Company today. We're going to be talking about home remedies for a cold with Cleveland.moms like me. We'll be right back with more Good Company today.
This segment of Good Company was paid for by Bristol Myers.